1800s, a bizarre and terrifying phenomenon was reported. Some people's teeth actually exploded in their mouths. This unsettling occurrence left many puzzled, and to this day, no one knows for sure why it happened. One prevailing theory suggests that these explosions were due to untreated cavities. In an era where dental hygiene was rudimentary at best, cavities often went untreated. As the tooth decayed, it created an ideal environment for gas production. The process of decomposition and bacterial activity within the tooth generated gas, which gradually built up pressure inside the tooth. Without modern dental care, people in the 1800s had little recourse to prevent or treat such dental issues. As the decay progressed, the tooth structure weakened. The pressure from the accumulating gas increased steadily. Eventually, the internal pressure reached a critical point where the tooth could no longer contain it, leading to an explosive outcome. Accounts from that time describe sudden, sharp pains and the alarming sound of a tooth bursting, often accompanied by significant damage to the surrounding tissue and gums. These reports, although rare, were distressing enough to be recorded in medical and dental literature of the period. The lack of advanced dental practices and tools meant that people often endured severe dental pain and infection. Toothaches were a common and dreaded part of life, and the threat of an exploding tooth added to the anxiety. While this theory of gas buildup and pressure-induced explosions is plausible, it remains speculative. No definitive scientific evidence has confirmed it as the sole cause of the phenomenon. The 1800s were a time of limited medical understanding, and many occurrences that seem extraordinary today might have had explanations rooted in the period's lack of knowledge and poor health practices. In conclusion, the mystery of exploding teeth in the 1800s serves as a stark reminder of the advances in dental care and hygiene that we often take for granted today. It also highlights how far we've come in understanding and treating dental health issues, ensuring that such frightening occurrences remain a thing of the past.